that's a very important thing that everybody, whether you're taking a DNS course or not, needs to understand, that they aren't static, fixed postures or positions that are ideal and everything else is crap. These are... When DNS talks about primary stability of the spine and pelvis, obviously we talk about specifically diaphragmatic function. How do you go about describing this primary stability, when it occurs, how does it occur, what is quality versus poor quality?
The sagittal plane stability, as we can see, has become understood as vital, not only within the DNS community, but even amongst the scoliosis community. Practitioners have come to understand that sagittal plane stability is vital for maintaining the correction of scoliosis, for example. So we can come to see not only is the curves that develop later on uprighting, as varied as they are a necessary physiological component of the spine, but that the sagittal stabilization is important. Now, we ascribe to the use of intra-abdominal pressure regulation as the primary factor in this stabilization. We speak of the respiratory diaphragm and the pelvic diaphragm and their interaction in promoting intra-abdominal pressure. The contents of the abdomen are neither uniform nor of the same density or motility or symmetry. You have organs that are tethered, some that are not so tethered. You have the intestines in a fascial curtain. You have kidneys that are tethered. You have ligaments that hold various organs in position and allow a certain amount of movement. However, given all this, the volume of the abdominal contents changes constantly, whether due to gas formation or due to ingestion of food or the expulsion of liquid or feces. The constant change in volume means that we do not have a reliable volume that we can biomechanically use to stabilize the spine per se.
And just to say it, again, the DNS perspective follows from human motor development, which ultimately says that for the first 3 months of life, the newborn and the baby has absolutely no stability. There is no control.
There's no function.
Every movement, right? Yeah, you're right. There's no functional stability. Obviously, they have some stability based on the involuntary ligaments and things like that connecting the system. But a 2-month-old, a 6-week-old is not capable of performing any type of purposeful movement or isolated movement because they cannot produce any sort of muscular support or stability. And that initiation of stability that we're describing now begins and should be accomplished by about 3 months old. And the source of that stability is the combination of respiration through the diaphragm as well as coordinated abdominal wall and pelvic floor muscular activity that generates intra-abdominal pressure.
Mm-hmm.
Correct? This is
Yes.
how we're describing it.
Mm-hmm.
And obviously within the abdomen, like you said, there's all of this viscera and all of this stuff that is in one sense constantly changing through gas, through, like you said, liquid, feces, all the rest of it. It's not symmetrical, but in one sense it's acting almost like a functional unit,
Mm-hmm.
through which we're respiring and co-contracting a bit to produce and generate this pressure. And it
Mm-hmm.
is that pressure that you are now getting into, which is um, the source of that very primary sagittal stabilization. That's
That's right.
accurate, right?
Yeah. Yes. So, um, as far as we can see, the that canister, which needs to be stabilized, must actually have a rapid ability to stabilize so that there is no risk, undue risk to the spine or the adjacent joints that must leverage power from the stability chains, etc.
Right.
So it means that given the range of motion that we do express in the torso under different circumstances, whether they are for work or for leisure, we are able to maintain a stability that is phenomenally flexible under different circumstances, even when we do not have ideal biomechanical relationships between the diaphragms. This
Right. And
must
now you're
be
talking about this, when you say this ideal relationship between the diaphragms,
of
the DNS
parallel.
model, right? Yeah, the DNS model of better or ideal stabilization function is based on the idea that when the respiratory diaphragm and the pelvic diaphragm are brought into somewhat of a parallel relationship, that is the most optimum and effective posture to be able to generate this intra-abdominal pressure.
That's right.
And that fact comes from the posture that we see the 3-month-old baby utilize in order to
Mm-hmm.
first generate
Mm-hmm.
in order to first get stability.
Yes.
The idea being, if there was a better way to get stability, the baby would have done that, but they're not.
Yes.
They're using this posture in this way. And
Mm-hmm.
what you're saying, which again, people take a DNS course or don't take a DNS course and come away with this idea that that being the ideal or most effective way to do it is the only way to do it.
Mm-hmm. Mm-hmm.
You said something that is vital, which is flexible.
That's right.
Obviously the spine and the joints are mobile and flexible, and when they're out of this quote unquote perfect alignment, that does not mean that the posture is bad, and it doesn't mean that you cannot be stable there.
That's right.
And that's a very important thing that everybody, whether you're taking a DNS course or not, needs to understand, that they
That's right.
aren't static, fixed postures or positions that are ideal and everything else is crap. These
That's
are,
right.
in every single position, you have the ability to stabilize with quality.
That's right. The important thing is the neuromuscular coordination that surrounds the stabilization strategy.
Yeah, yeah. It
We,
goes right back. It goes right back to that, where we cannot. The fundamental aspect cannot be a biomechanical musculoskeletal aspect. It has to be a neurologic concept.
that's
And
right.
therefore, the position in space is almost irrelevant because the
Mhm.
neurology is the fundamental aspect of it.
The neural, yes, that is true.
If
The
you
ability,
enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.